There are going to be some critical feeding milestones that we're wanting to be seeing at around the age of 6 months. The first thing that we're looking for is that Palmar grasp. So we're wanting babies to be able to grab something with their whole hand. As they start to get older, moving towards that 9-month mark, you'll see them actually starting to be picking things up almost with their whole fingers. So you'll see things like that, moving up with that whole hand. The last thing that you're looking for is the pincer grasp. So for our babies to be able to put their thumb and their index finger together, so grabbing things. And this will be seen at around the age of 9 to 10 months. Other critical feeding milestones are going to be what they can do with a spoon. So first off, it's really just about holding the spoon. The next milestone with the spoon is when we're getting closer to around the age of 1 year. And here we're wanting babies to be able to start to really scoop. Following on from that, it would be being able to scoop and then being able to move the spoon and actually putting it properly into their mouth. They might be showing this earlier, but tends to happen is that the spoon gets turned around and they're figuring out where it actually needs to be going. Another critical milestone is going to be teething. And what's actually happening, the importance of teething. We need stimulation on that gum line to help our teeth actually start to come out. So our babies don't need teeth to start feeding, but we need to start stimulating. What's really great about the tiny cup is you can actually start giving this to your baby before they start to eat, for them to be able to start gumming. And this is going to be stimulating that gum line and so bringing about those teeth. Some developmental milestones that we're looking at when feeding is we're really wanting to avoid using a normal sippy cup. When we're looking at normal sippy cups, it really over-exaggerates the development of the lower jaw and does not help with the development of the upper jaw. Versus when we're using something like the tiny cup, you can see as my mouth clamps over, I'm getting both my lower and my upper jaw, and so my jaw is able to develop the way that it should anatomically. With your ezpz products as well, our spoon is much smaller. So when we're looking at the developmental stage, that tongue thrust, if our spoon is too big, we can actually start to bring back that tongue thrust reflex again. And so if something too big comes into my mouth, I'm trying to push it back. With the ezpz tiny spoon, this is going to fit beautifully into your baby's mouth and so help encourage that tongue thrust reflex to stay away and continue to work its way out.